Welcome to the Sunshine Training Center. For tips, how-tos and videos on burn rehabilitation, subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. Today, we're focusing on two powerful interventions for burn rehabilitation: active range of motion exercises and stretching exercises. These interventions can help burn patients regain mobility, reduce stiffness, and improve daily function. First, let's look at the different kinds of exercises used in burn rehabilitation. AROM, or active range of motion, involves moving a joint using your own muscles. AROM, or active assisted ROM, means movement with help, either from a therapist, device, or another body part. PROM, or passive ROM, is done without muscle effort from the patient. It's all external, like when a therapist moves your arm. Stretching is about going beyond normal motion to lengthen tissue. Passive stretching happens when a therapist or device does the work. Self-stretching means the patient stretches on their own, with therapist guidance. Why AROM and stretching? In rehabilitation, the goal is always to help patients move better on their own, so AROM is key. AROM exercises help maintain muscle and joint health, and they also boost coordination and sensory feedback. They are also important for developing coordination and motor skills for functional activities. Stretching is crucial because scars, especially over joints, can tighten and limit movement. Stretching exercises help reduce the stiffness of these scars and maintain or increase flexibility around joints, preventing contractures from worsening and aiding recovery of movement. Improved flexibility and range of motion from stretching allow for more comfortable and functional movement. This can make everyday tasks like dressing or walking easier and less painful, leading to increased independence. When to use AROM and stretching. AROM is safe and useful through most stages of recovery. However, there are exceptions, such as when the joint needs to be immobilized, like the initial stage of skin grafting, or exposure of the dorsal tendon of the proximal interphalangeal joint. Performing active joint ROM exercises can produce muscle contraction, help increase venous and lymphatic return, and reduce edema. After wounds heal, gentle AROM should begin to restore motion and reduce swelling. If the patient can't do full AROM due to pain or weakness, start with assisted AROM. Stretching is recommended when movement is limited by scar tissue or muscle tightness. Stretching exercises help reduce the stiffness of these scars and maintain or increase flexibility around joints, preventing contractures from worsening and aiding recovery of movement. The method of stretching is to stretch the scar or joint in the opposite direction of the contracture. The appropriate intensity of stretching is the degree that allows the scar to blanch. Avoid stretching if a bony block restricts joint movement, or if there is an incomplete bony union following a recent fracture. Additionally, stretching should not be performed if there are signs of inflammation or infection, such as heat and swelling, as it could exacerbate the condition. Stretching may also disrupt wound healing, so it must be carefully evaluated. Other contraindications include sharp and acute pain during joint movement or muscle elongation, and the presence of a hematoma or other indicators of tissue trauma. Which should come first, AROM or stretching? That depends on the goal. If the goal is reducing stiffness, start with AROM to warm up. Then stretch. If active exercises are performed first to warm up, the pain felt by patients from rehabilitation will be milder. Then, performing stretching exercises will further enhance the joint mobility effect achieved by active movements. For example, use shoulder movements first, then stretch using sandbags. If the goal is better functional movement, start with stretching to gain more range. Then do AROM. Starting with stretching exercises can increase the range of joint mobility. When this is followed by active exercises, because the joints are stretched more easily, muscle contraction and the control of coordination between nerves and muscles are strengthened, which leads to improved movement performance. For instance, stretch the hand manually, then perform palmar pinch to pick up small blocks. The sequence of burn rehabilitation exercises should align with the patient's priority goals. If the focus is on reducing stiffness, AROM exercises done first can ease pain before stretching. For patients aiming to enhance functional movement, starting with stretching primes joints for improved active performance. What are the key takeaways? AROM and stretching work best together, they complement each other. Use AROM to build strength and control, and stretching to reduce scar tightness. Always adjust based on wound healing stage, pain, and functional goals. If you're a therapist or caregiver assisting the patient during exercises, guide the patient with clear timing and technique. Thank you for watching. Remember to subscribe to our channel for more burn rehabilitation related tips and videos, and visit our website for news about our latest training programs.